This new mom is anxious because her infant is sick for the first time and asks, when should I call my pediatrician and or 911? What symptoms are considered serious or life-threatening in babies?
Well, if you're concerned about your infant, especially a newborn one, it's very important to call the pediatrician right away. The first few months of life, the baby is very delicate, and many things can cause the baby to get sick. Specifically, if you think that your baby doesn't look well, that's probably the biggest reason you should call your pediatrician. But also if the baby's not feeding well, having a fever, cough, congestion, looks like he or she is having trouble breathing, vomiting, or any change in the stools, those are all good reasons to call your pediatrician. I think she was worried about 911. I probably would call 911 again if you're really worried about how the child looks, but more importantly, if the child looks like he's stopped breathing, if he's not looking the right color, if he's not moving like he should, or, of course, if the child's fallen or somehow sustained an injury.
It makes good sense. I know I've been that kind of parent at Friday night at 7 o'clock. That's when the fever appears, or that's when something seems like I need the doctor. Do you think at that point, you usually have people who are on call in your practices. Is that true? Should you call your pediatrician and see if you can get through to a nurse practitioner through your pediatrician's office, or
Sure.
do you call the hospital?
I think the best thing to do is actually try to get through to your pediatrician because they know your child best. And certainly all doctors' offices have some call mechanisms in place even after the office is closed. So don't worry about the time. Somehow kids do tend to get sicker at night and on Friday nights, and I'm not saying that facetiously. It seems to happen a lot. So feel free to pick up the phone. You know, it's very important if you're worried about your child.
But 911, never hesitate, especially if they're looking blue, not breathing, those kind of really.
Absolutely. If you're worried, again, use that maternal instinct. If you think you need to call. The guidelines are what, I said, but of course, I'm not there with you, so you would have to decide that on the spur of the moment.
Don't worry about being too cautious, in other words.
Especially with a newborn, especially with a young infant.
Okay.